When most people think about dental problems, they picture cavities, stained teeth, or maybe even bad breath. But one often overlooked issue can quietly undermine your oral health, setting the stage for gum disease and tooth loss, tartar. In an educational discussion, Dr. Amelia Jenkins, a respected dental health expert with years of experience in preventive dentistry, stressed that tartar is far more than a cosmetic nuisance. Yes, it can make your teeth look yellow or rough, but the real danger lies beneath the surface. Tartar provides a secure home for harmful bacteria that not only damage your gums, but can also spread inflammation to other parts of your body. Left unchecked, it can progress to periodontitis, a severe form of gum disease that can cause tooth mobility and eventual tooth loss. This expanded guide dives deep into what tartar is, why it forms, the conditions that accelerate its buildup, and most importantly, how you can prevent it naturally and effectively. We'll also explore daily habits that protect your teeth, common mistakes people make, and expert-approved tips for keeping your smile healthy for a lifetime. What exactly is tartar? Tartar, also called dental calculus, is the hardened form of dental plaque. Plaque itself is a soft, sticky layer composed of bacteria, food particles, and proteins from your saliva. If you run your tongue across your teeth at the end of the day, that fuzzy film you feel is plaque. In the early stages, plaque is relatively easy to remove with proper brushing and flossing. However, when plaque isn't cleaned away in time, the minerals naturally present in your saliva, primarily calcium and phosphate, combine with it, causing it to harden into tartar. Once it reaches this calcified state, no amount of regular brushing will get it off. Only a dental professional, using specialized tools, can remove it safely. Tartar can form above the gum line, supragingival, or below the gum line, subgingival. Both are problematic. Above the gum line, tartar is visible as yellow or brown deposits along the edges of your teeth, especially near the gum margins. Below the gum line, tartar is more dangerous because it's hidden, making it harder to detect. It can irritate your gums, create deep pockets, and harbor aggressive bacteria. Over time, tartar acts like a fortress for harmful bacteria, shielding them from your toothbrush and mouthwash. This bacterial stronghold keeps producing toxins that inflame the gums, leading to bleeding, swelling, and eventually the destruction of the tissue and bone that support your teeth. Why does tartar form? Dr. Jenkins identifies four main factors that significantly increase the risk of tartar buildup. 1. High sugar and starch consumption. Sugary snacks, sodas, pastries, white bread, and other starchy foods are like a buffet for the bacteria living in your mouth. These bacteria feed on sugars and carbohydrates, breaking them down into acids. Those acids not only erode your enamel, but also create an environment where plaque thrives, quickly transitioning into tartar. In the American diet, where processed foods and sweetened beverages are common, this is one of the top culprits behind rapid tartar formation. Even seemingly healthy items like flavored yogurts or granola bars can contain high amounts of sugar. 2. Acidic oral environment. Your mouth's pH level matters more than you might think. A low pH acidic condition creates an ideal breeding ground for harmful bacteria and accelerates the hardening of plaque. Drinking acidic beverages like citrus juices, soda, and energy drinks, or eating frequent acidic snacks can shift your mouth's pH in the wrong direction. If your saliva isn't neutralizing these acids quickly enough, plaque mineralizes faster. 3. Dry mouth. Xerostomia. Saliva is your body's built-in defense system for oral health. It neutralizes acids, washes away food particles, and provides minerals to repair early enamel damage when your mouth is too dry due to dehydration. Certain medications or medical conditions, plaque accumulates more easily, and tartar sets in quickly. 4. Biofilm formation. Bacteria are highly adaptable. In your mouth, they can organize themselves into a biofilm, which is like a protective shield that makes them harder to remove. Once this sticky matrix forms, brushing alone often isn't enough to dislodge it. Without proper disruption, the biofilm can calcify into tartar. Natural methods to prevent and break down plaque. Jenkins recommends several natural approaches that work alongside good dental hygiene. to reduce plaque and slow tartar formation. While these methods shouldn't replace regular dental visits, they can be powerful tools in your home care routine. N-acetylcysteine. NAC is a compound known for its ability to break down mucus in the respiratory tract, but it also works on oral biofilms by disrupting the sticky matrix that bacteria build. NAC makes it easier to remove plaque before it turns into tartar. Xylitol, natural sweetener, found in certain gums and mints, does more than satisfy a sweet tooth. Xylitol makes it difficult for bacteria to stick to your teeth and stimulates saliva production. Increased saliva means better acid neutralization and plaque clearance. Oil pulling with coconut oil. This ancient Ayurvedic practice involves swishing a tablespoon of coconut oil in your mouth for 10 to 20 minutes. Coconut oil contains lauric acid, which has antimicrobial properties. The oil can bind to plaque and bacteria, allowing you to spit them out. Baking soda. Mildly abrasive. Baking soda can help remove surface stains and plaque while neutralizing acids in the mouth. It's important to use it gently. Too much scrubbing can wear down enamel. Hydrogen peroxide. A diluted hydrogen peroxide rinse can kill anaerobic bacteria, the type often linked to gum disease. It also has a mild whitening effect. Essential oil. Some essential oils like tea tree, peppermint, and clove oil have antibacterial and anti-inflammatory properties. When properly diluted, they can be added to mouth rinses for an extra layer of gum protection. 5 daily habits for long-term tartar prevention. Jenkins emphasizes that the real secret to a tartar-free smile is not just one magic product, but consistent, everyday habits. Brush before breakfast. Bacteria multiply in your mouth overnight. Brushing before eating removes them, reducing the acid load when you start your day with food. Floss first. Flossing before brushing dislodges food and plaque between teeth, allowing your toothbrush to clean more effectively. Rinse after eating. A quick rinse with water, xylitol solution, or baking soda after meals can help neutralize acids and remove loose debris. Reduce sugars and starches. Cutting back on these foods not only slows plaque growth, but also improves your overall health. Stay hydrated. Water helps maintain a moist mouth, stimulates saliva production, and naturally washes away bacteria. Expert cautions. While natural remedies are helpful, overusing some, such as baking soda or hydrogen peroxide, can harm your enamel and disrupt your oral microbiome. Dr. Jenkins reminds patients that consistency with gentle, proven methods will always outperform aggressive quick fixes. Thank you so much for watching. Your support means the world to me and keeps me motivated to create more valuable content. See you in the next video.